Hello guys, I'm Jonathan Munoz and today we're going to talk about some questions I prepared for the interviews that you're going to have. Um, One more thing, today is November 25th, it's Thanksgiving Day, so happy Thanksgiving. And if you happen to have a interview next week, it wouldn't hurt to bring it up by saying, um, happy Thanksgiving. I hope you had a nice time with the family. Americans love to celebrate Thanksgiving. It's actually, I believe they like it better than Christmas. And I don't know why. Um, but to me, I like Thanksgiving because they make turkey. And in Christmas time, they make ham, which I'm not very fan of. I didn't grow up eating ham for any celebration holiday. So for me, turkey is special, and Thanksgiving is the only time of the year I can eat it. Anyways, let's move into the questions. So I will try to explain some of them that are a little difficult, but the simple ones you can just use straight. So let's start with number one. What are the strengths of the program? Number two, how is it to live in this city? Number three, what percentage of your residency graduates end up doing outpatient medicine within a group versus hospitalist work versus private practice? So, for family medicine or for internal medicine, outpatient medicine within a group is to be a primary care physician out in the community. And within a group means that there is a group that is hiring for doctors, and you are an employee of them. You're basically on a salary and limited to that group or to what the group wants to do. And the other option is hospitalist work. Hospitalist work means, as an internal medicine or family medicine, just staying in the hospital to take care of inpatient medicine patients. The last subset is private practice, and not many residents venture into this right after residency, because to start your own clinic, your own office, you need capital money, investing money, at least $100,000 to $150,000 to set up your office and to start with one medical assistant. So you need some money to do that, and most residents don't end up the 3 years of training with much savings. So that's a good question to ask. It opens up to know how many of the graduates stay within the area, how many of the graduates get hired into faculty positions. Next question: how many of your residents go for a fellowship in geriatric medicine or palliative care? So for family medicine, the most asked fellowships are sports medicine and sleep medicine, maybe. Not many people ask for palliative care or for geriatric medicine. For internal medicine, of course, you have the cardiology, gastroenterology, rheumatology. So not many people ask for these two. And I believe these two are going to be game changers for primary care doctors, or especially for underserved communities, because as the population age, we need more specialized care on the problems that affect the elderly. Now we don't have as many. We get to learn about geriatric medicine as we go, but ideally you have some proper training, and it is thought that doctors that get into geriatric medicine or palliative care will get more attention, will get more clients. Next one, which outdoors activities are the most popular in this area for residents? Something to ask your fellow residents. I'm pretty sure they will tell you. Like, if you ask me what is there to do around the area of that you train, so there is a couple of college cities around where I train. There's a couple of hiking trails that are very popular that go for 5 miles, and I used to do that on a daily basis, not daily basis, but every other day when I was in residency. 5 miles just to take the stress away and to relax at the end of a busy day. So that's how it opens a conversation. Next one. Where do residents live during residency, and what are the most recommended areas? So, a question to ask to other residents, because when you're foreign, and you come to this country, you don't know where you're getting, where you're going to start doing residency, if it's a nice area, if it's an area where people want to live, if it's an area where a single person that is also looking to meet someone wants to live. So the residents will know. The residents will know, okay, don't live in this area. If you want to have some social life at the end of the day, go live in this area, 5 miles away, 6 miles away, something that is doable still within residency. So something to break up the ice, to break the ice, and I don't think it will hurt. I think if it's actually a good source of information. Next one, for the residents coming close to the end of their training, which rotation do you think was the one that they learned the most from? And this is something to I I will ask this to the residents that you will interview with, because they will tell you which rotations they like the most and why. For example, to me, I liked or I enjoyed the most to do the geriatric rotation. It's the one that I learned the most. It's the one that kind of shaped my interest into inpatient medicine, skilled nursing facility work, and home health work. So for me, this is the one that shaped me. Next one, do you get any financial education during residency? This is something to ask to the residents, and it's always good to be proactive in financial knowledge, and I'm pretty sure many appreciate that mindset. So if you would happen to ask me this during an interview, I would be like, oh, that's very interesting that you ask, because within the benefits that you get as a resident, one of the benefits that you get is to open a retirement account at that early age. So you could start by doing that, and not many use that. But as we graduate, as we move into more advanced positions, we start appreciating these things. So someone that comes with these questions of what are the possibilities of a retirement account or retirement planning, it gives me the sense that this person is mature, that is this person is settled. It's someone that's not going to get into trouble, someone that's looking for the future, that maybe has a family depending on them, that maybe has commitments that he has to complete, fill up. So next question. Are there medical groups that recruit residents to stay in the area after graduation? Why do I say this? Because after graduation, you don't start just working alone because you want to work. You don't start working by the hospital, to the hospital. The hospitals in this country don't hire doctors directly. There's only some of them, but most of them don't hire doctors directly. They hire them through a medical group. So let's say I started my medical group, the Munoz Medical Group, and I have hired within my group Dr. Patel, Dr. Reddy, Dr. Munoz, and Dr. Mendez. So all these doctors are part of my team. Now, if there's a hospital that wants 3 doctors, I say, oh, I have all these, choose one. So they choose which doctors want to work at their hospital, and at the end of the month, they pay me for their services, and I pay them. So they don't deal with the hospital directly, they deal with me. And why is this important? Why is this a question? Because the attendings or the residents, they will know which groups are around. Usually within the hospital, once you are in the hospital, you meet all these groups and you say, oh, you're with this group, you're with this group. So which group is the best? And they will tell you, they will know, oh yeah, at the end of the 3 years, you could stay local with this group, with this group. I belong to this group, I belong to that group, and they will tell you all these things. And it's good to know, because it kind of gives you the sense of, oh, okay, there are job opportunities around this area. Next one. Okay, what recommendations do you have for new residents in how to explore and understand the cultural beliefs that the community has? This is a good question for the attendings that you will interview. It's a very thoughtful question, because each community that a hospital is situated at has a specific demographics, right? Like you can be very heavy on Hispanics, heavy on Afro Americans, heavy on who knows which population. So all of these, each of these populations have a particular way of thinking, a particular way of living, beliefs, and how good you understand these beliefs, these ways of living, will determine how good or how much can you reach, how good, how well can you help these people, and how well can you become accepted, how easy will you be accepted as a physician in the community. So understanding beliefs, and usually people knows, like if you ask me, what do you think in your community is important for them? I would say, well, my community is heavy on Hispanic patients. So for them, family, for them, safety, for them, discrimination, racial discrimination are important factors to consider when interacting. So I would say start by understanding those topics. Okay, next one. Is the exposure to patient care at nursing homes enough to continue this work after graduation? Is it possible to get more exposure to this field, specifically if you're interested in a fellowship in geriatric medicine or palliative care? And why? Because during residency, you do have rotations or you do have work to do at local nursing homes. Nursing homes are facilities where patients that are in need or more physical therapy go before they transition to home. So um, it is limited, but if you have a particular interest, you can ask for it. You can ask for more patients at the nursing home, and they will give it to you. So I know for a fact that if you ask me this question, I would say yes, of course. If you want to do more nursing home and geriatric care is one of your focuses, then go for it. We can give you more patients to go to all the nursing homes in the area. And I will recommend to do that as a resident, because after graduation is one pretty good source of income. Next one. I understand hospitals have different committees that discuss topics such as morbidity and mortality, patient satisfaction, quality improvement. Are residents encouraged to participate in these conversations? And the answer is yes. Now, with faculty program directors don't want to give you these responsibilities if you don't want to, but they appreciate when someone volunteers to be present in one of these committees and represent the residency program, because after you go there, you get to know something that's going on in the hospital, and you can communicate this back to your peers, and they appreciate this interaction with the hospital because you are representing them. You're showing them that how useful the residents are. Why? Because usually residents are looked down on because they take longer times to treat patients, they take more resources, their nurse-doctor interaction is lower than a hospitalist, a graduated doctor. So something to consider. And next one is there formal education on clinical documentation improvement during residency? And as you know, I'm big on clinical documentation improvement because that's something that I do in this place. So now it's not easy to have the new doctors, the fresh graduates understand why it's importance of being very accurate on sepsis, septic shock, diabetes with complications, and respiratory failure, malnutrition. Is not very easy because they think most people that just graduate say, I'm here to be a doctor, I'm not here to make money. But you don't understand that the places that you are work or are there because someone is making money to continue the work. So not only that, but proper documentation, accurate documentation impacts the way a patient is evaluated in the hospital. Mortality, morbidity, risk of readmissions, are all calculated based on your documentation. So if you document a patient that's very sick, the risk of readmission is very high compared to a person that just came for a simple pneumonia. So things to consider. And if you ask me this question, I will be inclined to say, well, yes, there is, and we like to teach you little by little what are the parts of good documentation. I'm glad that you asked because it makes me believe that you are well aware that documentation is important. Um, Next question. In what ways are residents able to connect with the community other than the hospital continuity clinic or the hospital rotations? And why is this important? Because when we look at your curriculum, we see how good are you at having a history of community involvement. Now, it's a good starting point because I think, okay, this guy may want to be involved with the community. So how do I know this? And then you come with this question, and I say, oh yeah, sure, definitely. You can participate on free clinics. You can participate on vaccination campaigns. You can go teach classes at local schools or churches or at the local homeless shelter, and different ways that are not described in the curriculum. But if you ask, I will know what to say. I will know. Oh yeah, yeah. You can go to this free clinic we have at the end of the month every month. Volunteer there for one day. Why we don't give all this information at the beginning is because you are your job description only involves what is on the curriculum. Anything else is add on, and it's not forced upon residents. It's more of a volunteer work. So that ends the questions that I prepared for you to ask residents and attendings. Take a look on this. I'm gonna add the questions at the end of at the bottom of the page. So if you have any questions to me, just send me a message or comment down. Thank you.